Good afternoon, everyone. My name is Chioma Naiji. I am a senior program director at the Multicultural AIDS Coalition that is located in Boston, Massachusetts. We're a grassroots organization focused on addressing HIV and AIDS within Black and Latinx communities. On behalf of United We Rise Planning Committee, I would like to welcome you to our two-part policy webinar series. Today is part one, where we will focus on introducing you to the United We Rise Black HIV Policy Synergy Report. It's a report that was developed over the past 2 years. And now United We Rise is really focused on what does it mean to implement some of the recommendations that came out of this report. I would like to acknowledge our funders, Gilead and ViiV Healthcare, for their generous support in the work that we've done over the past several years. I want to let folks know that you are on Zoom webinar, which means that you are in view only mode. So all participants are muted and off video. We are live streaming, so you can also share on Facebook, Instagram, and other platforms. Let folks know to join us on @EveryBlackBody. Even though we're on webinar and you're not able to come off mute, we definitely still want to hear your questions and your comments. So please, we encourage you to share your questions and comments via the chat mode. And also at the bottom of your screen, on the toolbar, you'll see a Q&A icon. Click on that and you can also pose your questions. Just so you know, our journey that we're going to have today with you all, we will be doing welcome and introductions. You will get an overview of United We Rise for people who are new to United We Rise. You'll get an overview of the Black HIV Policy Synergy Report, and we'll definitely be able to send it out to you after this webinar. And then you'll hear from some great activists who are doing the work around addressing HIV in Black communities. You'll hear from them a little bit later. So now I would like to share with you a video about United We Rise and introduce you to our 2022 Planning Committee members.
As I think about what we've accomplished over the past 40 years in the HIV epidemic, we've done really good work in effective diagnoses, testing, prevention, and treatment of HIV, but we still have many inequities and inequalities that exist.
We cannot survive or thrive in silos. It has to be a coming together where we coalesce and unite in this fight if we're going to end the epidemic.
I decided to join and stay with United We Rise because I'm so proud to be in a space that is led by us, defined by us, designed by us.
I needed to be involved in an organization that first of all had a national database and a nationwide emphasis, and one that was focused toward our people for us.
I feel like this is a powerful space that's centering Black people in a deliberate way, in an intentional way.
We are here to let our voice be heard in regards to how we would see the addressing of HIV from our perspective.
A Black response to HIV is one that is inherently intersectional.
It's led by Black people, implemented by Black people, evaluated by Black people, and then of course, impacts in a positive way the lives of Black people.
HIV really has to be a holistic response. It has to be something that addresses the social determinants of health, right? Our education, our socioeconomic status. It has to be something that is complete, that actually speaks to the whole person.
Those people who are most impacted are heard.
It would mean being unapologetic in our Blackness, infusing the arts, culture, spirituality, sexuality, all of these different parts of ourselves would come together in an intersectional way.
When you're able to be strong and advance yourself and really meet the needs of the people, that's really where we really need to be.
After we convene and after we plan these strategies, we put it into action and then go out into our communities as well as together, forming coalitions that help to make this thing better.
Now I would like to welcome our moderators for this afternoon, Sean Bland and Jennifer Barnes.
Good afternoon.
Good afternoon, everybody.
Afternoon. So again, my name is Sean Bland. I'm a member of the United We Rise Planning Committee and also a member of the Policy Work Group. I'm excited to be here with you all today. I use he, him pronouns. I'm a lawyer by training, and I have worked in the area of HIV law and policy for several years. And I'll also just pass it over to Jennifer to introduce herself and to kick us off.
Sure. Good afternoon. I'm Jennifer Barnes Balenciaga. I am, let's see, currently a student in Manhattan, New York. I just transplanted from Atlanta. I was there for 11 years where I did a lot of work with State Representative Park Cannon of District 58 as the LGBTQ liaison. And I am also the director of Crystal LaBeija Organizing Fellowship. And with those spaces, the last name of Balenciaga, I've made sure to, with my own diagnoses of HIV, provide space, information, and understanding around advances with HIV, necessary needs of inclusion with HIV, and its reports with policy, as I came on to State Representative Park Cannon's team as a policy advisor through Georgia Equality. So now I am so proud to be co-lead of the policy work group. And I hate that I couldn't have made Atlanta. I love that video so much because it is very true around the centering and the work that we do. Very huge thank you to Chioma as well as Dr. Stefan Wallace for the reach out for that. So, next slide. We want to make sure to give light to our mission, which is to unite and mobilize a collective force to end the HIV epidemic and uplift the quality of life for every Black body. So why every Black body? Of course, you know, I absolutely love that. Being a Black woman and being raised by a Black woman and a Black man and seeing some of the struggles that they went through their young adult years, as my parents had me relatively young, on to adulthood, and seeing some of the ways in which their, let alone work and career, but their healthcare services and the way that physicians and other healthcare professionals involve themselves with them. My stepmother is an RN, a DPN now, and it's been very close to home to watch and see some of the interaction that HIV has done to our community. So being a part of this space helps me bring back every Black body, honoring the history and diversity of the Black diaspora. You know, every Black body embodying collective liberation from systems that do not value us and the internal struggles that engender. Every Black body values the various ways individual experiences of Black people are both unique and intersected, meaning I would like to break that down a little bit. Not every Black story is the same. We come from an array of backgrounds, an array of culture differences with a lot of similarities and a lot of parallel stories, but they should all be equally respected and paid attention to. And Every Black Body is a coalition effort dedicated to the well-being of people living with HIV and to the improvement of the physical and mental health of all our communities. Again, as you heard in that video, making sure and paying attention to holistic care and interaction between people, it's transitional, especially in this day and time, as we continue to understand and be included a little more as the focus of all of these material goods. Let's make sure that we continue to push forward in our inclusion of all things leading to our healthcare and taking care of us as every Black body. Sean?
Great, thank you so much, Jennifer. I'm so excited to be able to kind of share a little bit more about United We Rise, the areas that we're working in, and also to tell you about the policy working group. So as we kind of think about kind of the work that we're doing, we have, Jennifer mentioned the mission. We know that we're not going to achieve that mission in terms of ending the HIV epidemic and uplifting quality of life for, again, every Black body without centering Black people. And also prioritizing community investment and really community control of resources. And to that end, we have focus areas for our planning committee. And so there are 5 of them: sexual and gender identity, policy, intersectionality, Black leadership and organizations, and community engagement. And hopefully many of you have kind of looked at our website, followed us on social media, and so maybe you've been seeing work from each of these focus areas. This webinar is being held by our policy work group, so we're going to really be centering policy. And so in terms of how we kind of describe and think about our work, we work to democratize power and amplify policy approaches that destigmatize and decriminalize Black bodies, centering knowledge, experiences, and voices of the people closest to problems leads to a flexible and expansive policy making that produces intersectional solutions. And so really when we're thinking about those solutions, we're going to really need intersectional policy to actually be able to achieve those goals. So really a question that we're putting forth here and all the work that we do are what are the federal, state, and local policy changes that, if enacted, would have a transformational impact on Black health and liberation. So next slide. These are my fellow policy work group members: Dante Prayer, Jennifer, who you've already been introduced to, Malcolm Reed, Marsha Jones, Ronald Johnson, and also Timothy Jackson. And so we're a small group, but I think we're doing a lot of amazing work, and we hope to also be informed by kind of the discussions that we're going to have at this webinar to inform some of our future work as well. So next slide. So now we're going to kind of really spend a little bit of time talking about the United We Rise HIV Policy Synergy Report. And so that synergy report, it identifies 9 policy directions, which are really common themes that arose from the review of 7 regional and national reports. And so we'll tell you a little bit about the 7 reports, and then we'll hear actually from some of the folks who are actually involved in those reports, who can kind of share a little bit more information, and then we'll have some time for discussion. And again, throughout this period, please use the Q&A feature to ask questions or to make comments, and we'll try to make sure that we can respond to those questions and comments in the time that we have. And I just want to emphasize also, as we think about this synergy report, which I believe we can share in the chat if we haven't already, we can share that document. It's a work in progress. So again, this is a report that we first released in December 2020. So this was after kind of more than a year of United We Rise existing, having a series of planning committee meetings, reviewing the policy reports from, again, national and regional Black-led organizations, hearing from them, learning from them. And then this synergy report really synthesizes that information. So it's a pretty short document. And we think short documents are really helpful. Hopefully they're digestible for you. We can kind of share them and actually be able to implement them in terms of policy change. But it really is a synthesis of, and really builds upon, and hopefully highlights and gives life to some of the amazing work that's been done by Black-led organizations from across the country. So next slide. So I'm gonna give a little bit of information about the 7 reports that were referenced. So I'll go through the first few, and then I'll pass it to Jennifer to talk about some of them. So the first one is the We the People, a Black Plan to End HIV. So this was a report that was developed by and released by the Black AIDS Institute. So Max Boykin is one of our panelists. I know he was at the Black AIDS Institute at the time, so he might be able to share a bit more information about it, but it really is a multi-pronged approach to ending the HIV epidemic, focused on dismantling anti-Black institutions and practices, making major investments in Black leadership in institutions, increasing access to high quality health services that are culturally appropriate, affordable, and also gender affirming, and re-energizing Black communities to help end the HIV epidemic. So next slide. We also have the HIV Advocacy Needs Assessment. So it's a which identifies health policy and advocacy opportunities for Black communities in the South. That was developed by the Southern Black Policy and Advocacy Network. We're going to have a chance to hear from the founder and CEO, Vinton Jones, about the development of that report. So I'll kind of leave that there. We'll hear a bit more from him in his remarks. Next slide. And I'll pass it to Jennifer.
Sure. Black women's health imperative. Needs of Black women at risk of acquiring HIV and those living with HIV, specifically understanding this type of policy agenda specific to the Black woman, as we know, the most disenfranchised individual in America, and continuously underswept, let alone not even paid attention to on the formula of a lot of the medications that are on market right now, and the need to have that inclusion with research moving forward is going to be imperative. Need to include Black women HIV research, funding, and programming, socioeconomic issues that limit Black women's ability to seek prevention and treatment for HIV. The National African HIV/AIDS Initiative. HIV initiative focuses on African communities. Key recommendations from this initiative in Summit Report includes calls for African civic and religious leaders to encourage open dialogue about sexual health, model non-stigmatizing attitudes towards people living with HIV, community advocacy on collection of data on African immigrants, culturally responsive HIV and healthcare services. Black South Rising, the future is now. I love that slogan. Call for Black leaders, elected officials, and foundations to radically rethink their efforts and approaches to combating the HIV epidemic in Southern Black communities. Urge to defund or change systems and organizations that cause harm to Black lives. Need to center Black community-driven approaches to HIV in the South. Moving for Black lives. I just have to tell the story. So my work first began truly at the M4BL convening in Cleveland, Ohio. What was that? Oh my gosh, 2015, 2014, something like that. Oh, and yeah, 2015. It was an amazing experience. It was, first off, Cleveland being one of the cities, that is so transitional in Ohio. Being an Ohioan myself, it was such a privilege to return to that space and see so many Black faces and Black leaders and Black excellence amongst that space. So truly, truly a blessing for myself. I've met the majority of my colleagues at that specific space. Movement for Black Lives, a Manifesto for Liberation for Black People in the United States. 14 briefs that offer policy and legislative recommendations to address institutions, policies, and structures that cause harm to Black lives in the US. The BREATHE Act: divest our tax dollars from brutal, discriminatory policing and invest in a new vision of public safety, a vision that allows all people to be represented free and thriving. Sean?
Great, thank you. The seventh report that was part of the that informed the United We Rise Synergy report is from the Black Alliance for Just Immigration, and so it really examines trends and issues affecting Black immigrants and also community demands. And so really it's important, again, to think about intersectionality. I think we've seen from all the reports that we're focusing on particular populations. So whether it's the South, whether it's women, whether it's immigrants, kind of different populations. And so here we're thinking specifically about Black immigrant populations. This is a growing population within the United States. Black immigrants are overrepresented in immigration detention and deportation. So again, thinking about kind of how involvement in immigration detention kind of intersects with kind of meeting the needs of Black immigrants who are living with HIV and those who might benefit from access to HIV prevention options. And really just really thinking about the holistic health and the broader kind of well-being of this population. And specifically looking at the criminalization of Black immigrants also as being a major concern. So next slide. Again, so based on those 7 national and regional reports, and so again, I think we really should be uplifting the fact that this work has been done and has been done by Black-led organizations. We, United We Rise, kind of thought through it and really kind of tried to distill some major common themes, so areas for policy mobilization. And so 9 particular areas were identified in the Synergy report, I think which should be hopefully accessible to folks in the chat. One is divest and dismantle destructive systems and institutions that harm Black lives. The second is to invest in solutions that address root causes, and really centering root causes of increased vulnerability to HIV. And again, many of those root causes are also responsible for increased vulnerability to other STDs, to COVID, and to a range of health issues, and really kind of thinking about what those root issues are. So again, systemic racism being, I think, a key one, but again, all those intersectional issues in terms of homophobia, transphobia, poverty, criminalization. Number 3, expand access to universal healthcare that is culturally and linguistically appropriate. And so again, making sure we recognize the diversity within our communities to make sure that we're providing culturally competent care and care in the languages of different immigrant communities or other communities in terms of their the language that they use first. Number 4, demand sexual health education and facilitate access to prevention technologies such as condoms, PrEP, and syringe services. Number 5, increase community energy and urgency about ending HIV. And next slide. Number 6, reform public policy that stigmatizes and criminalizes people living with HIV and inhibits effective prevention for people at increased risk for HIV acquisition. So again, thinking about the role of HIV criminal laws and other forms of criminalization that disproportionately impact our communities. Number 7, hold elected officials accountable for the implementation of transformative policy to eliminate HIV equity in Black communities. Again, we know that there are lots of plans that have been rolled out over the years. So we have National HIV/AIDS Strategy, we have an Ending the HIV Epidemic Initiative. But if we're not actually making sure that in implementing all those, that we're centering and focusing on Black communities, we're not going to really be we're not doing anything to help anyone, and particularly our communities. So really holding folks accountable to do that. Number 8, promote Medicaid expansion to increase healthcare access, especially in southern states. Medicaid expansion has really been one of the core things in terms of some of the progress that we've been able to make in terms of reducing new HIV infections and increasing viral suppression and HIV outcomes. But again, we still see disparities. And so those disparities are reflected also or come from the fact that in many southern states and many of the states where a lot of Black folks live, they haven't expanded Medicaid. And so this has to be a critical tool for really addressing healthcare access and inequities. And number 9, integrate specific strategies that address inequities for Black populations most impacted by HIV, including gay, bisexual, gender nonconforming men, women at increased risk, both cisgender and transgender, people who inject drugs, immigrants, and others. So next slide. So now we're going to move into our panel. And so I have just the honor to be able to be joined by 4 distinguished panelists. So we're so excited to have with us Max Boykin, Vinton Jones, Amanda Lugg, and Jamel Young. So I will ask them all to kind of turn on their camera so that we can see them. And so I'm not going to read their full bios because they are quite impressive and long, but because you could go on for a while, but I just want to kind of just mention what organizations they're from. And so Amanda Lugg is the interim co-executive director of African Services Committee. Jamel Young is the founder and executive director of TMSM Connect. Max Boykin is an organizer and activist, and he is part of creating multiple coalitions, including the HIV Racial Justice Now and Black South Rising. And then Vinton Jones is the chief executive officer of the Southern Black Policy and Advocacy Network. So again, I'm excited to welcome all 4 of our panelists today. And I want to just make sure that we kind of get started with our first question, where I'll give each of the panelists an opportunity to kind of introduce themselves a little bit more. And so I'll start with this first question. So again, briefly introduce yourself. And if you or your organization were part of a report, please tell us about that report. So, you know, the different reports that we just went over, please tell us a little bit about it. And then maybe just answer this question. How does the United We Rise Synergy Report connect to the reports that you or your organization was a part of, or connect to your work more generally if you weren't involved in a report? And so again, I think I'll have one of you, I'll just choose one of you to kind of kick us off. So Max, can we start with you?
No problem. Thank you so very much, Sean. Thank you for the introduction, Sean and Jennifer, and leading us in this discussion today. Like I said, my name is Max Boykin, organizer, activist. I helped with the creation of the We the People report. Also, I was there when we were formalizing and creating both Black South Rising and HIV Racial Justice Now, 2 different coalitions supported over similar things that they wanted to happen, but different formations. HIV Racial Justice Now, wanting to really understand that we had a declaration of liberation of really speaking on what we needed truly to end the HIV epidemic, and understand in this moment, at the moment when we created the Declaration of Liberation, was just a couple of years, was actually we first started speaking to one another right after Trump took office. And then a couple years later, seeing some of the shifts that happened within the South, particularly with the Black South Rising piece, we have seen some of the large shifts in needing more resources, more people, and more of the things that are necessary to actually end the HIV epidemic in the South around Black leadership, and also being able to create the things that we need to be able to change political, both the political space that we are in, but also changing the policies that are directly impacting us throughout the South. And I want to shout out both Charles Stevens for helping create both of those spaces, and also Nana Khanna and Benita Ray, both members of Positive Women Network, that were also very important for both those coalitions starting up. And I can't, without saying, with the Vision for Black Lives, I was not a core person that helped write it, but a member of the larger movement for Black Lives, and was also there with Jennifer in Cleveland, and seeing that some of the start of that space being created, where they were able to tackle all those policy issues, and using some of that energy and understanding that I had over the years, being part of the policy table with the movement for Black Lives, taking that to when I was at the Black AIDS Institute, of thinking about how in which we had a new State of Black AIDS report, that if you've been in HIV for a while, that was something that was a staple of BAI's coming out. The We the People report was in response to some of the things that we had been seeing that were not Black focused, that were not primarily focused, and also seeing at that time the Trump administration had put out a plan to end HIV. That some folks were really excited about. But we knew there was huge holes on the social determinants of health, the large impacts of things that were impacting Black folks across the spectrum of who Black people were. And we wanted to connect and bring some of those wonderful minded folks who were not just working in HIV, but in criminal justice reform, in queer liberation rights, in understanding also people that worked at health departments, folks that worked within the government, and bringing them all together to talk about the different spaces and understanding the intersectional issues we needed to end the HIV epidemic. And that was our ability to create the We the People report. Quickly on the things that I think that to focus on right now is both the first and ninth piece that were there, which was urging systems to transform and change, and dismantling systems that are not helpful to Black folks, and thinking about how in which we are doing that, about uplifting new leaders within this, and not just tearing down folks that are coming within. And then a huge one is we're seeing new attacks, even though we have we're supposed to have a more friendly administration on the federal side, continued harmful attacks on the state, and now also with the attacks on Roe v. Wade on the federal side, of how in which we're able to truly advocate, and seeing some of our rights for our folks that are most marginalized taken away from them. And those two, I think, are some of the most important things for us to be able to do. Outside of one thing that I do want to also highlight is I do not believe that we will get to the ending the HIV epidemic, the bold pieces that we need, by just expanding healthcare into Medicaid expansion. I think we have to be bold in saying that everyone needs access to healthcare in this country, and that's the only way that we will truly end this epidemic, and along with the epidemics that we have been most recently impacted by.
Thank you so much for that. We want to make sure to bring light to Amanda Lugg. It's such a pleasure to see you here and the longevity of your work. And thank you for being able to take the time to come and speak with us. Would you please feel comfortable with discussing your thoughts around the UWR report and how it connects with your work?
Sure. Hi, everyone. Thrilled to be here and among like-minded folks that look like me. Fabulous. Hey, so yeah, I've been here at African Services since 2000, and working in HIV direct services since 1994. Clearly, obviously, there have been huge moves, some for the better, some for the worse. But from 2000 at African Services, not too much has changed as regards delivering our HIV care in regards to the stigma and the issues that we're familiar with around engaging Black communities and the stigma involved. I have to say, though, that African Services, we're based in Harlem, and we serve the African immigrant community, Harlem, and we're looking at about 90 to 95% of the approximately 6,000 folks that we see on an annual basis. About 90-95% of those are undocumented, which shifts our work enormously. Perhaps I can come back to that later, but I know the question around the report that we were involved with. This was the NAHI report, the National African HIV Initiative, that involved myself, Chioma, and about three or four other folks representing African serving organizations. We came together in 2007 through the Office of Minority Health, convened a meeting, and we met, and again, 2007, we saw the need to not so much produce a report, but we were really excited about bringing together all of those folks, those organizations that primarily serve Black immigrants. Unfortunately, we were ahead of our time at that point, though we did convene. Chioma, you're going to help me here. How many did we convene? We convened four summits in Atlanta, Boston, Seattle, Washington, and DC area to really get a diverse group of folks from across the country, rather, to talk about the barriers, the challenges that us as a Black community fighting HIV were experiencing. And unfortunately, as it sounds like it still is today, right? The stigma was number one. Very close to it was the absolute need for more research and data sharing on Black immigrants, so that like for most states, New York and Massachusetts may be slightly different, but most states, the numbers are conflated, into the Black/African American, and the Black immigrant community rather kind of gets rendered invisible in those numbers. So really the importance of breaking down the numbers between us. We're not a monolith, right? And I understand the AAPI community is going through the same thing, right? We're not all Asian. We're from so many different countries, similar to African immigrants, of course, from the continent, but Central America, South America, around the world. So yeah, we came up, we developed the report. And we had hoped to carry it on, but this was in 2008. And I can't remember the exact reasons why. We kept in touch, but we weren't able to fulfill the goal which we had at that time, which was to, bringing more people together in a regular and sustainable way. Okay. Sure.
Thanks, Amanda. Yeah, we'll have more time for, again, more questions that we'll put to each of you. But just in terms of the kind of introductory question, I'll go to Jamel, just to kind of introduce yourself. I don't think you were necessarily involved with any of the kind of underlying reports, but really just to think about how does the United We Rise Synergy Report connect to some of your work, particularly focused on trans communities, Black trans communities.
Absolutely. Hello, everyone. My name is Jamel Young. Thank you for having me in this space. I am the founder and ED of TMSM Connect. My mission is to assist, affirm, and advocate for assigned female at birth, trans, and GNC individuals, centering those who are bi, gay, pan, and queer. And generally, our focus is around sexual health and reproductive justice. And as mentioned, no, I'm not directly associated to any of the reports mentioned, but certainly the work is in alignment, particularly highlighting the recognition of the disproportionate impact of Black people, the demand for high quality health services that are culturally appropriate, fundable, and gender affirming. Definitely investing into Black leadership, particularly trans leadership, and also re-energize and educating the Black communities to help end the epidemic, for sure.
Of course, we would love to hear from the Vinton Jones. Thank you so much for taking time to join with us, and we greatly appreciate it.
Thank you so much. Well, good afternoon, everyone. Again, Vinton Jones, founder and chief executive officer of the Southern Black Policy and Advocacy Network. And part of our work we've actually been around since the beginning of United We Rise, and have really focused our efforts. The Southern Black Policy and Advocacy Network, actually, let me take a step back. Our work focuses on improving health outcomes, social and economic and public health outcomes through impacting public policy for Black communities in the southern sector of the United States. And our work since our founding in 2018 has been particularly focused on the Ending the Epidemic initiative and some of the other HIV initiatives that were listed, like the National HIV/AIDS Strategy, Fast Track Cities, Getting to Zero, and some of the other initiatives. And so when we talk about the Ending the HIV Epidemic initiative, what we wanted to do with our report that we created in our HIV assessment was to do an assessment of key states, southern states that had a high burden of HIV in the state, and put together a collection of data reports that you can see on one document the impact of HIV kind of across the spectrum when it comes to southern states and the Black epidemic in these southern states. We also work to create strategic conversations through our Southern Black HIV/AIDS network that was made up of Black HIV leaders and policy leaders to talk about what were some of the things that were needed in order to address and impact HIV. Now, when we talk about a lot of these reports, of course, one thing that we really have to acknowledge is the impact of the COVID-19 pandemic with all of these different reports. Because when we talk about COVID-19, we understand that COVID-19 messed everybody's report up. And because it impacted how we were moving in this conversation through these HIV planning efforts that were coordinated through many health departments that literally stopped their work for COVID to redirect to COVID responses. So part of this work that went into the 2019-2020 preparation that really that would have really centered a lot of our reports, it stalled when COVID-19 hit. And so for the Southern Black Policy and Advocacy Network, what we are looking at is actually remodeling this assessment, because we didn't even have a COVID pandemic that was going on at the time to now talk about this. And now when we talk about the conversation around HIV, we have to talk about the disruption that COVID-19 has caused in the response to HIV. And on top of that, the poor planning, the poor implementation that took place on the ground by local health departments to even get these ending the epidemic plans off the ground. And just to be honest, it is very disappointing to see the implementation of the Ending the HIV initiative in so many southern states, where Black people are really only listed as the epi to make the case for the need for the resources. When we look to solutions, particularly for Black communities in these Ending the Epidemic plans, we oftentimes are not seeing a centering of Black communities. We are not seeing a centering of brown communities. And we are continuing, health departments are continuing to utilize the resources that's supposed to be going into ending the HIV epidemic by 2030. So when you talk about a place like Dallas County, where the burden of the HIV epidemic is 50% African American, you cannot end HIV in Dallas County without talking about and centering the needs of Black communities. And not only centering the needs of Black communities, but being able to diversify your language to where you are talking about several marginalized populations of Black people that are at the top of the HIV epidemic in the South. Another thing that really has to be discussed in these conversations are the political dynamics that are taking place, particularly in southern states. During the COVID-19 pandemic, we've seen this, but we've seen this throughout years of the work, how political structures have not responded to our communities and have actually done things that actually hurt and harm our communities. I live in the state of Texas, where we're seeing attacks on LGBTQ populations. We are seeing attacks on women and the right to be able to make the important choices that they need to make with themselves, their families, and their medical providers, and just the anti-Black systems that continue to operate in the South right now. And so we, part of our work that we're working on right now is remodeling this assessment tool so that we can speak to how do we get back on track with this Ending the Epidemic initiative, or how do we encourage our public health officials to imagine what does this plan mean, and are we really on track for ending HIV by 2030? And is that something that we can really still believe in right now? So I think this conversation is so timely right now, because I think that it's going to take all of us coming to the table and talking about what do those strategies mean in the face of this post-COVID society that we are in right now, that many of the reports that were created were already created and printed out before we had to deal with this pandemic. And so one of the things I think that is so critical right now is that we not only hold elected officials accountable, that we also own our power and become elected officials. One thing that was huge for me, in addition to being able to run the Southern Black Policy and Advocacy Network, is that I'm actually in the runoff right now to be the state representative for a House district that is highly impacted by HIV. Thank you for the claps. That is highly impacted by HIV, and I think that we all have to own our power in our own local communities to be able to become that person we're trying to hold accountable. And for me, that really allowed this conversation for me to take this to the state level, where we're seeing so many changes that are happening, that are harming people living with HIV. Whether we talk about the influx of money that we're supposed to be seeing in our state, but we're dealing with a $34 million ADAP shortage. We're dealing with the formularies for the different long-acting medications that are supposed to be happening, not only for HIV prevention, but also for HIV treatment, and the issues that are happening with insurance companies and negotiation that really that our elected officials are really primed to be able to address. So just the encouragement of everyone as we look at this and look to others in our state. I think that there's so much leadership and so many lessons learned that we've learned from the HIV epidemic that are critical right now, and that are needed not only to end HIV, but to really make our communities a better place. And so many people in this space are primed to be able to do that in an elected capacity.
Great, thank you so much, Vinton. I always love to hear from you, and so thankful and grateful for folks like you kind of stepping in to run for elected office. We definitely need more of that. And again, thank you all for joining us and for those introductory remarks. So I'll go to our second question. So the United We Rise Synergy Report was created in December 2020. Obviously, a lot has happened since then. Maybe we can kind of just talk about some of those really key developments and issues. So obviously, Benton already mentioned, obviously, the COVID-19 epidemic, and obviously how that's impacting the ability to do HIV treatment prevention, to address the social determinants. And just more generally, what are kind of major policy developments, opportunities, or threats that have happened kind of since the end of 2020 that are really relevant for promoting the health and liberation of Black communities? And again, I think the rollback of abortion rights that Max mentioned as well, and several folks have mentioned, is really critical. So that's a big question, but like kind of what's happened since then? What are the things we need to be kind of aware of and prioritizing to really be able to use them to get back on track and to really have that progress? So maybe we can start with Amanda, and then we'll kind of go from there.
Yeah, thanks. Thank you. So yeah, there's nothing good about the COVID pandemic, but I think if we were forced to find some positive out of these last 2 years, I think is the stripping away and the really laying bare the health disparities within the US. Speaking just to my experience here in New York, it was over people of color, Black and brown folks were overwhelmingly disproportionately affected by COVID. And at the same time were overwhelmingly, I think in the New York State came out with something like 58% of all essential workers were actually immigrant workers, who you can generally assume to be Black and brown immigrants. A number of our clients were in fact caretakers, at-home caretakers, sorry, and delivery folks, taxis, what have you. So I would say that, yeah, that's a good thing. We probably hear at least once a day, the term health equity. I think it's become a term du jour, which at least in New York has opened the doors to a lot of folks within the health and HIV movement to really talk about HIV and pandemic related issues within our Black and Brown communities. And that is a good thing. And just in terms of, yeah, what's happened since 2020, I think that realization, it feels like to me, across the country is like, oh yeah, disproportionate Black and Brown folks disproportionately hit by COVID. And wow, let's look more closely at these disparities and how we can build some equity here. At least that's what we're hearing in New York. I understand that many states are very different, but that's what we're getting here in New York, which is a good thing,
And D. Jamel, did you or have anything that you might want to add to that question in terms of what we've seen over the last few years?
Yeah, so one, as a person that's kind of new to this space, even my org being relatively new, just made a year in March. One of the things I've seen is stronger collaborations within Black organizations and allied organizations, even within just inviting me to the table and our persons like me, and including our experiences and our voices. So that's something I'm happy to see, that there's really this bigger movement going on. As well as I've seen a lot of movements around defunding the police. I've been a part of MBLA in SNAPCO's Solutions Not Punishments cohort, in which we were going out to community, talking to communities about our initiative to defund police and what that could look like. And I guess that would then segue into the Breathe Act that's in legislation right now. So in that aspect, I mean, I see that there's better direction. I'm not all the way informed in all the things that's going on, but it's hopeful. It's hopeful.
Shout out to BT, yes. Can we please make sure that when we're including our responses, that it's okay to make it personal as well? It's okay to be very upfront about what you find defines these last 2 years, because it is like the most transitional space that we've had since, they call it the Spanish flu, but we all know that it shouldn't have been named anything after any culture. But specifically that time that pounded us, some of us, and what it took. I mean, how beautiful is it for Benton to be running for all, like this space? It allowed our Black people, honestly, a chance, if I may say, to catch up. So I appreciate every sentiment that is being given, because it was something personal and different to everyone.
Mm-hmm. Yeah.
Max or Benton?
Thank you so very much for that, Jennifer. Oh, Benton, you can
go. So to that point, say the question one more time, because Max just threw me off.
With the UWR report being created in December of 2020, what has been achieved since then? It can be something that leads from the actual report itself, or from what you found in your own personal delvings in the last 2 years.
Well, I think that, to me, the report, really revealed that. I think that, because I'm trying to see where I'm going to go with this. Am I going to go off the chart or keep it calm? But I'm just going to do a combination of things. I think that it revealed that a lot of health departments were bullshitting community, and because we have these tools that were being created. And so at first the conversation was around, well, there wasn't enough data. So these different groups came together and created data to make cases for these ending the epidemic plans that were supposed to be submitted by December 2020. So most of these plans were already in place and being circulated. What we saw in 2020, and most of this was blamed on COVID, but I think that I'm calling BS on that. These things were supposed to be used in these local strategies, and when we are on the flip side in 2022, we're not seeing the strategies that were being put forward in these local plans. And so for me, what was revealed to me was even in the midst of a pandemic, was a challenge again for Black people to have to again dig even deeper to make sure that things were being done, because again, the plans were on pause, but the money was being spent. And we know that in these different communities. And so what these plans, particularly the United We Rise plans, it's been a huge tool for not only like the Southern Black organizations like the Southern Black Policy, but many of our organizations to be able to show and see that this is not just an issue in Dallas. This is not just an issue in Atlanta. This is not just an issue in Washington, D.C. When we talk about Black communities, there is a failure of service to Black communities and the Black epidemic across all of our different jurisdictions that we must focus on. And I think that is a huge advocacy tool that we really have to take into our work as we come back to these tables, especially as we're being convened in person, to be able to show that you told us health departments, you told us feds that we were going to double down in making sure communities were most marginalized and disenfranchised would be the center of these local and then the epidemic strategies. And now that we see the plans and they are not, we need to get back on board. And not only can I use SB Pan's assessment, I can use this strategy and synergy report to be able to show that this is not just something that SB Pan is saying. This is something that Black communities across this country are saying, and we must do something about it, or we're going to be nowhere close to ending the HIV epidemic, and particularly for Black communities who are the most in need of it, because it was said before and said again, in many HIV spaces. I think Phil Wilson was, said this when one of our communities, has when other communities, just have a cold, we're dealing with, pneumonia, and that, in addition to trying to balance HIV with COVID, and in addition to sitting in our living rooms and having to, during a pandemic, watch ourselves being killed by those, entities that were supposed to protect and serve us. It lit a fire in me personally that even led to me running, but also led to me, even doubling down with SB Pan's work, because I know that, from a policy perspective, our systems that are supposed to be working on our behalf are not serving us. So now we are having to come in and save ourselves. And that's exactly what we're doing through this effort in this report and our continued work at the front lines of fighting this epidemic.
Thanks, Benton. And really thank you for highlighting how we really need to be using your report, the other reports highlighted, and really the United We Rise Synergy report to really hold folks accountable and to make some future progress. And that'll, I think, will dovetail to our kind of follow-up webinar that we'll be doing in June, just really how we can kind of move forward with these reports. But yeah, thank you for highlighting that. So Max, I don't know if you wanted to kind of respond in terms of, again, any kind of policy developments, opportunities, or threats since 2020 that really are relevant for thinking about advancing the health and liberation of Black communities.
Yeah, so there's a couple that I'm thinking on this to think about. I was like, I think a huge one is healthcare access. I'm never going to stop saying that one. That's one that we has been played with, right? But we did expand certain access to it during COVID-19 that did help certain folks get access to the things that they needed. But it's not enough, and it's not continuous. And now we're definitely dealing with some of those protections created by COVID rolling back. That is going to be a real fear going later into this year, along with the actual access to resources that folks continuously need. I think another huge one that I'm also is how in which we are talking about access to PrEP, especially with I think some people have many times said access to PrEP needs to be as easy as access to birth control. But if you see right now the attacks on both anyone getting an access to an abortion, along with then the attacks on Plan B pills and other pieces, we also have to think about like, what does that truly mean when other parts of our communities are being attacked? What is the HIV community's like response to that? We've seen such entities as Positive Women's Network and some others that are working to have better responses around this work, but we could do a lot more. And I believe one of the things that we have been talking a lot about within a number of one of these reports, I can definitely say within the We the People report and pieces that came out of United We Rise was being intersectional. That means we need to stand up. Talk more around when these issues are being done, and that includes the attacks on transgender bodies. I also want to shout out the local organizing that I have been able to see since 2020, particularly since the uprisings that have happened within 2020. I seen, personally what DJML and them with SNAPCO and 4BL were doing here in the Atlanta area in getting a monumental change in an electorate that we had never seen in the state of Georgia in that type of shift. And especially in a special election. And we are also, again, many of those things that we have seen that were things that we saw some progress in 2020, including when I also want to say is access to PrEP, in seeing that Cabotegravir has been the shot that folks can take has come out of or is getting out of the study routine of like it should be approved by the FDA and then eventually be on market for folks, and means more even access for folks to get access to this. But if we type hold it and try to stranglehold how in which it is actually feathered access to everyone, then we will never get to the ending of the HIV epidemic that we want, because on top of all these things that we've continued to see, people that have had new access to job opportunity because of the pandemic, also going to places that they cannot get access to the care that they need as easy. And that is one of the most disheartening things to see, is when people are able to mobilize, being able to like get something that they've been trying to be able to have access to for years, and when that comes to employment, education, and other pieces. But then when they actually get to that place, they do not have the care that they need, and they cannot get to the PrEP access that they need, or to their HIV medications, or whatever other life-saving medications people are dealing with. That is the real problem, and where we see some steps going forward and many steps going back.
Can I add to that, since particularly cabotegravir was mentioned? As a person living with HIV, something that was discovered during this 2021 time was I tried to take this medication and actually got kicked off of it and had to go back to Biktarvy. And those are issues that we're seeing now with insurers, with the debate now that is happening around, is this a medical expense or is this a pharmacy expense? And conversations that medical providers are needing to solve with our insurance companies, because what's creating a barrier with that medication is that this is putting people living with HIV, in the middle of that conversation. Because if a person changes their health insurance, or they change their coverage, that could be the difference of them qualifying, for a medication that we're being told that you should have easy access to. But even in my position and the information that I know about, HIV medications and access to HIV leaders, I still got kicked off of this medication. And I think that we have to look at that as a challenge that we've already, when we talk about the pills, the challenges with making sure that all of the different, ADAP formularies include these different, pill medications. But now when we look into the injectables, the issues that are coming with between the insurance companies and the medical providers around who's going to pay the upfront cost of getting these medications into those doctors' offices. So I think that is definitely a conversation that we really have to take to the insurance companies to make sure that they are working with the medical providers and the specialty pharmacists to ensure that treatment is truly available to everyone who needs it.
Thank you, Max and Vinton. This is, there's so many kind of really critical issues that all of you have spoken to. I want to just think about kind of another question, because again, there are just a range of areas that we need to be focusing on. What are some of the policy silos that are kind of out there? Because we know that these silos often can contribute to some of the issues that we're seeing. And if we're not thinking about de-siloing our approach, we may not be able to have the success that we know we need to be having. So it's a pretty general question. I'll let anybody who wants to kind of go in first to kind of jump in.
I would say that a silo that hasn't necessarily been created, but just between us, between Black folks, is the when we're talking about HIV. This may sound very selfish, but to be including undocumented immigrants, to be including immigrants when we talk about Black AIDS in America, Black folks living with HIV. The numbers, Black immigrants are the largest growing immigrant group in the country. I think it's the Pew Research just this year told us their report that more than half of Black immigrants, 58% of Black immigrants arrived after 2000. And with that, immigration is so intrinsically linked. Immigration policies are so intrinsically linked to healthcare. To healthcare policy, to healthcare access, and those are the silos that I keep coming up against.
And anyone else? If not, I can ask another question that's kind of related.
Go ahead with the next question.
Just how does public policy, not specific to HIV, continue to stigmatize or harm people living with HIV? Or those at a higher risk for acquiring HIV. And so really thinking about public policy around kind of issues that Amanda just raised around immigration, but around other issues as well. So whether it be drug use policy, bans on needle exchanges, or kind of other policy that kind of limits access to harm reduction, thinking about issues specific to sex workers or other populations. Yeah, just thinking about how the policy, both at the federal, state, and local level, continue to kind of really set us back and really harm folks that are in our communities.
So there's a couple that come straight to mind. One is the continued attack on queer, but specifically transgender rights in this country, and how in which, especially with states across the country attacking, really continuing on the culture wars. And I think I want to call out, particularly, I believe in many within the HIV community being more focused on the money or the funding that will continue to support some of their organizations than focusing on the intersectional approach of how these things are impacting people. Of course, bringing up the piece around transgender rights, but of course, women's rights around Roe versus Wade, and then continued attacks around that piece is a huge one. I also think around how in which states are using their tax money is a one that we have need to. Taxes are not sexy. They are not the fun thing to talk about, but they are the thing that funds the majority of the work that we do. And like HIV testing typically is funded mostly through those type of funding. Those are huge things for us to look into, of like where that money is going, and not just worrying about if the money is going to the organization, but how that money is also coming into the state is going to be really important, especially with some of the pieces around like where some of the federal dollars is going versus local and state money that we need support to be able to truly, in the HIV epidemic, is needing that matches from state money in the healthcare services, and also making sure that we expand healthcare access. But one that is a silo that I keep seeing that I don't see as like taking a next step around is also how in which we talk around like what is safety for our communities. Safety typically is many times talked about policing, how in which we can surveil people as much as possible and those things. But for a lot of folks, especially for people living with HIV, more surveillance is not necessarily what they want. More surveillance is not what folks who even use PrEP like to be able to live their lives better. I think the actual thing that we're asking for when we're talking about safety is knowing truly how much the medication costs, how much these different things are actually costing us, how much, and having more control over how in which that medication is being used from those organizations on people's bodies. I think those are some of the more important like silos of understanding the cost of medication, and I want to call out Gilead and ViiV, who are also sponsoring this, but also the ways in which they spend money on lobbyists within the district for increase around things around getting them more money, but not necessarily making it as most affordable, and expanding for and asking and using some of those resources to ask for the things that we need, particularly in the South, around healthcare access.
Great, thank you. So I will go to kind of the last question that we have, and then we'll have a chance to get some more of the questions. We have at least one from the audience. We may get a few more, so I just want to give a plug for folks. If you have a question, please put it in the Q&A. You can also kind of make comments in the chat. So the last question that kind of we have is just, what are some of the most important federal, state, and local policy changes that, if enacted, would have a transformative impact on the health and liberation of Black people? So again, this is kind of starting to move us towards like what's going to really lead to that positive change, and hopefully will set us up for our kind of second webinar, which will go into more depth, and we'll hear from some of you again, and we'll have some new voices as well. But again, I'll repeat the question. What are some of the most important federal, state, and local policy changes that, if enacted, would have a transformative impact on the health and liberation of Black people? And I think maybe this time we can start with Jamel.
Yeah, so definitely want to echo something that Max said. I agree that having access to great healthcare is important. So I would start with saying medical expansion, if not universal healthcare, definitely is important in this in obtaining our goals. And as I mentioned earlier too, police reform, and finding better ways to assist our community in those tough situations, and so that, you know, yeah, in short, yes, police reforms.
Thank you. Maybe we can go to Vinton next.
Sure. It was already mentioned by Jamel, but definitely the expansion of Medicaid. Even in just Texas alone, there's $12 billion that would be released if Medicaid was expanded in the state of Texas. And there are many states, particularly in the South, that would benefit from those resources throughout the medical system. And then, of course, making sure that in places just like Texas, in places just like Florida, that we implement statewide and in places where it's not initiated non-discrimination policies that need to be put in place. Of course, stigma and discrimination and attacks on communities of color who are of course at the top of the HIV epidemic. Putting those things in place could help communities feel more safer in not only accessing medical services, but as we say, public safety and addressing stigma and discrimination, which is something that prevents people from even walking in the doors of their medical providers or other places that they can get treatment or care if they're HIV positive.
I'm guessing I'm next, Sean. I would say for our community, it's certainly been around access to state-funded Medicaid, well, I guess it would be Medicaid expansion in other states, but the essential plan that folks here are able to buy into. We've been, since 2016, we kind of gave up on any federal advocacy for undocumented immigrants. If you remember who entered the White House at that time. And like someone mentioned earlier, it hasn't got that much better under Biden, but we've concentrated our advocacy work on state policies rather than any federal. And the number one on our agenda for consecutively actually for 4 years now has been a campaign we call Coverage for All, where we're asking for the state to allow undocumented immigrants to not to give them free healthcare even, but to be able to buy into the state funded essential plan for health insurance. It's a strategic step towards the goal of universal healthcare. As Jamal mentioned, we are from an advocacy standpoint, we want to be sure, you know, when the rubber hits the road, there's always people, items that are thrown out or what have you. And in our experience, undocumented immigrants have been one of the first ones to be thrown under the bus, because no one votes for, you know, the politicians want to know, you know, if they're not going to be voting, why should they care? That's my favorite one. We have this last budget, we didn't get it in the budget, but we were able to get 2 significant wins, which meant that now undocumented immigrants over the age of 65 will be eligible to buy in to the health insurance, and also women, undocumented women will get 12 months of essential post-delivery care. So that's been a win, but like I say, these little steps towards a general universal health care. In New York, we're under the New York Health Act, which is what we're pushing. Again, as another step to a nationwide. That would be the best. But I think we keep coming back to the stigma question, right? Or the stigma issue, and I don't know what policies are gonna render that moot. I really don't. But picking up on a question that you asked earlier about over the last couple of years, something that has happened, again, just in New York State anyway, through our funding for outreach, COVID outreach into the neighborhoods for testing and vaccine education. We've now, organizations across the state have developed these fantastic cohorts of peers who are able to go into their community with this education. And we're now challenging New York City, DOH and state to not get rid of to keep building on this community engagement. Community has to be more involved in the yes, in the policies, but they have to be the ones on the ground. And again, at least for our community, in terms of engagement, we cannot depend on your regular DOH or just general health outreach and education. It has to come from community members, and that's what we're pushing for right now.
Yeah, thank y'all all for those pieces. I think so. I think on a national level, on a federal level is, of course, we're gonna I'm gonna push it. Protection of Roe v. Wade, making sure that people have unfettered access to abortion, along with big pieces around expansion of healthcare. But the Office of Health Equity that was created within this piece needs and needing an expansion of that, how in which to truly work on not just making this equity word a word that they like to play with, but actually using it in a way to address the inequities, particularly for Black people in this country, and using some of that history and knowledge of how in which these health inequities were put in place, of actually calling those out, learning that history, and going back to the question around the challenges around prioritizing, sexual health and your own personal wellness in a time where you've seen numbers of people die, and you're also trying to get back to this quote unquote normal, is that we have to create a healthcare system that is not just going back or trying to get back to normal or getting back to where we were. We have to actually do better, much better, in order to stop future pandemics and also address the pandemics that we're dealing with right now. And until we actually fully engage and address that level and the amount of funds that we're going to be able to do that, even with problems with getting future COVID-19 packages out, that those will continue to be an issue for us to be able to get to that full place of liberated space. And to go back on more things that folks can do on a state and local level, one is rent control. housing is you can't talk about nobody taking no pills. You can't talk about none of that if folks ain't got access to housing. Shout out to New York and some of the things that they were able to do around access to housing. But I seen, you know, tons of people come down this way and not have access to a place to live and think, oh, it's cheaper down here. But then with the way things have gone through the pandemic, that is not the way in many of these places. And we have to do something to address that. I think actually relatively soon. And I love, Kendall, thank you for bringing up sanctuary cities and bringing up that space and expanding what a sanctuary city is. It's not just a space where a person, no matter their immigration status, has access to there, but thinking about sanctuary as a place where a person can go and be safe. And I want to also local places being able to defund their police departments to actually fund resources and things such as the health departments, education systems, and thinking about being able to go to people in different ways to actually curtail violence within community. Those are the things that we need to be able to focus on. And I think that goes into the thinking and mindset of what a sanctuary city or sanctuary space can be. So I think both on local, state and federal levels, those are some of the different policies that we can be pushing to actually truly end the HIV epidemic.
I love that. The question that Max was giving towards and giving light to was a question from the audience that reads, can people speak to the challenges they've had during and COVID, communicating the importance during COVID, communicating the importance of prioritizing sexual health and wellness. And this person also went on to say, in Chicago for the last few months, we have seen dramatic reductions in testing that suggest certain kinds of apathy. So does anybody want to give more light to that?
I think the only thing I can probably say is over the last couple of years, we have been lucky enough to have COVID testing on site, and when people have come in, we don't let them leave before a little sit down and talking, beginning with how's things, how general health, and then including sexual health, wellness into that conversation. But I can't think of anything outstanding to say about it.
Understood. Thank you for that. Another question is, what is the role of Black solidarity, Black folks working together is solidarity, in developing, implementing, and sustaining transformative change for Black communities?
I feel like this question came from Chioma. I just want to say that out loud. But this is something that I've been struggling with, because I think we haven't always done a good job of it. Shout out to Jamel, Vinton, creating new organizations, spaces for folks to be and create new apparatuses or even new thoughts of what can be done. I want to be clear that I've also seen leadership, even from within this space of United We Rise, not support future leaders, not support organizations, and be able to move in a way where young people or folks that had different ideas than others be able to continue to push the narrative and start to change some of these things. And I've seen some of those narratives shift over the last 5 to 3 years, particularly some of those things are within COVID-19. But I have also seen where I think folks will think that they own the monolith of Black people, or that their particular piece, and that we'll forget about immigrant communities, we'll forget about transgender communities, we'll forget about formerly incarcerated, and we'll continue in a way it's like, oh, these people are okay, when we have seen where rural Black people in the South were disproportionately impacted during the COVID-19 pandemic. We saw where there's been a continued attacks on transgender people. We've seen those different things continue to happen, and seen leadership, particularly Black leadership in different pieces, go to a way, and I've seen this definitely within, I think, state Democratic houses across the country, of like, oh, we can't, go on this issue that's hard to talk about because an election's coming up. And that is the most bull answer that we've ever heard. And shout out to folks like Vincent, Devin Barrington Ward, and others who are, running for office and trying to also change that narrative and shift. But that is, I think, one of the pieces that is that needs the most work, is actually like us being able to work together and not leave other Black people behind.
Nice.
Does anyone else have any thoughts or additives? All right. Well, we really, really, really want to bring the space back to understanding that everything you've heard here is, I love the whole piece around UWR being almost a living, breathing document, a living, breathing, developing space that interchanges with a lot of different brilliant ideas, brilliant people, all whom are Black. A space that continues to give a light to how prolific it is if we take our own care into our hands, if we take our own development into our hands and work together in unity. Everything is not going to be hunky-dory, as we are Black people, and we are so expansive in our expression and decisions that we make. But to understand that the common goal for all of us is equity. We deserve the space and the right to exist in any way we see fit, as long as it is beneficial and helpful to our brother, our sister, or an individual who happens to be Black. I want to give a huge shout out and thank you to our funders. A huge shout out to the panelists for all the amazing ideas, sentiments, explanations, reminders, and the work that you do tirelessly. Like, this is a continuous movement, and we look forward to being able to partner and work with you all and those who are forthcoming. And a reminder that we have a second part 2 webinar on June 13th. It will be at the same time, I think, within the registration, and actually said that you could register for both. So if not, please return to it and you can sign up for the next one so we can make sure to continue this conversation as it is so needed. Any last thoughts, Sean?
No, again, I want to thank Jennifer for co-moderating with me and for being the co-lead of our work group. We hope to see many of you at part 2 on June 13th. And again, thank you to all of our panelists.
Thanks.
Thank you for having us. Shout out to Leisha and Malcolm in the comments.
Okay.
Thank you.
Thank you all.
Thank you all.
Peace.
Thank you.